The content of this podcast is for informational and entertainment purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your healthcare provider with any questions you may have regarding your mental or physical health. The views expressed are those of the host and guests and do not replace personalized care from a licensed professional.
Welcome to Mindful Moments with Pedro Morante, a space where a nurse practitioner and educator shares real talk on mental wellness, mindfulness, and navigating life in and out of healthcare. Let's take a moment to breathe, reflect, and grow together.
Hello everyone and welcome to Mindful Moments. Today's episode is Who Gets to Care? The Fight for Mental Health Access in Georgia. I am joined by two special guests today. Their name is Dr. Joanne Patterson. Both of us went to Brandman University for our psychiatric mental health nurse practitioner program and also our DNP program. She specializes with neurodivergence population, and also she's doing telehealth in different states: Georgia, Maryland, DC, Nevada, and also the US Virgin Islands. She was also featured last 2024 as guest at Kelly Clarkson's show, and also 2025 awardee by APRN and one of the most accomplished psychiatric mental health nurse practitioner. Also, we are joined by her best friend and also an advocate also of mental health, the one and only Dr. Nancy Hurlock. She is an author, motivational speaker, and also the founder for Nurses Your Mind. So this is a business platform that she created. What happens when qualified mental health providers are ready to help, but the system won't let them? Georgia is already facing a mental health crisis, with patients waiting weeks or even months for care. Now, new restrictions could make it even harder for nurse practitioners to serve the communities that need them most. Today, we're having an honest conversations about access to care, about mental health, about advocacy, and what's truly at stake for patients. If nurse practitioners are qualified in more than 28 states, then why not in Georgia? This is not about titles. This is not about access. So let's get into it. Let's get to the opening question. For Dr. Joanne Patterson, can you help listeners understand what is happening right now in Georgia?
Sure. Well, good morning, and thank you for having us on the show today. What is happening in Georgia, as in real time as we speak, is on the surface, the Georgia Medical Composite Board put out a statement about IV hydration therapy. And on the surface, it's labeled as guidance about IV hydration therapy. So a lot of people scrolled right through it. But when I actually read it, I saw that it quietly reinterprets the rules around how nurse practitioners work with our delegating physicians. It says that essentially any compensation we provide to a collaborating physician, including through third-party services, which many of us rely on, by the way, is prohibited. And I thought that this doesn't just affect IV clinics. This pulls under independent psychiatric practices like mine. So what this means is that there are several private practice owners who happen to be nurse practitioners that are being forced to close their practices because there isn't true guidance around how we should proceed with care, providing care in the state. We talk a lot about, patient mental health. We talk a lot about access to care, but what's happening right now is very exhausting, and it's demoralizing. We went into this work to help people. We trained for years. We're highly qualified, and we genuinely care about our patients. So to spend the energy fighting regulatory battles just to keep our doors open, on top of carrying the emotional weight of patients in crisis, it just wears on you. There's a real grief in knowing that you have skills and the willingness to help people in your own state, and being told that there are barriers in your way. So truthfully, the burnout in this field is already high as psychiatric nurse practitioners. And the policies like this one that is being concocted, it adds a layer of frustration that has nothing to do with actual care, and it pushes good providers out, and that hurts their patients too. So that is how it's really impacting this state.
I feel your frustrations and I feel you at this moment of time. But let's look at Dr. Nancy's Hurlock's standpoint. What does the current research actually say about independent nurse practitioner practice?
Thank you. I appreciate the question, and good morning again to you and your viewing audience. So as Dr. Patterson was referencing, this issue has highlighted what we've had as a challenge in Georgia for quite some time. This is one of many challenges Georgia has faced as APRNs have strived to serve their patient population for decades. But to answer your question, which is a very interesting question, we are not unique in terms of the full practice authority or that independent practice as a profession. There are states right now that nurse practitioners are functioning independent of a collaborative agreement. So the data is there. We often draw to organizations like AANP for the statistics because they're national organizations, but there's no question that we are qualified as APRNs. We are trained and we are fully ready and capable to fill needs. The question as to why Georgia has not allowed, that's a legislative question. One of the challenges we always have in our profession is that we have to be able to educate our legislators of the true impact these restrictions are having. This is not about APRNs as an entity, if you will, within Georgia. This is about the impact of the patients and the constituents of the legislators. We have parts of rural Georgia right now that, but for a nurse practitioner-owned private primary care practice, there would be no healthcare option right now in Georgia. These would not be in existence. If there was not a need or a gap for mental health services, services like Dr. Patterson would not need to exist. But the fact is there is a need. So we need to rethink what we're doing in terms of this being an adversarial type platform, meaning us against them. I'll just say this, I know I speak on behalf of many APRNs. This is not a competition. Nurses by design at our core, we're patient focused. That's what we do. And when you see us fighting and when you see us angry and frustrated, because we see our patients lacking quality access to healthcare.
Can you share a story of patients who may not have received care without APRNs or advanced practice registered nurses?
I can speak to that. I have a perfect example. So I had a patient, a parent actually, in rural Georgia. Their child was in psychiatric crisis, and there was no one or providers really to take on their case. And so from a virtual care perspective, I was able to fill that gap from Metro Atlanta. And I'll be happy to say that I saw them this week, and that patient is now back to work. So just think about, being in rural Georgia and your child's, well-being is at stake, and there aren't any mental health providers to fill that gap. That is where we come in. Because, the truth of the matter is that most people are not going to move. Most providers are not moving to rural, Georgia. And even if we don't, we still have a responsibility to those residents. And so us filling that gap virtually it's a no-brainer. It's what we should do. It's not even something that we should think about. So to have these barriers being created, in terms of us being able to provide care. I think it's abandoning the residents of Georgia. That's what it is. It is abandonment. It is patient abandonment. That's what's happening here.
Let's get your views on human impact misconceptions, politics versus patients. What does delayed mental health care actually look like for patients?
This is not delayed. This is an absence of mental health care. If we do not have, and by the way, there's an increase in the amount of psychiatric nurse practitioners in this country. We went from about 6,000 certified psychiatric nurse practitioners in the United States of America to 60,000. So when people say that there is a gap in mental health care, I don't think that's what it is. It is the prevention of accessing healthcare that's happening here. And again, this ruling, this position statement is going to prevent access more than delay it. Because if we're not filling the gap, who's going to do it? Who's doing it? Who is doing it?
We talk a lot about patient mental health, but what about providers? How is all of this affecting nurses and healthcare workers emotionally?
That's a good question. What I have seen, like Dr. Hurlock said, is that there is this uprising of the advanced practice nurses in this state. Usually, we're very, I don't want to say passive, but we try our very best to make do with what we have. That is what nurses do, but we're also very passionate about advocacy. I mean, one of the things that we do with our patients all the time is to advocate. So I think now the nurses are nursing themselves, and we are advocating for this profession. Enough is enough. If there are states that are saying that we are trusted as independent practitioners, then we are supposed to be trusted across the board. It is either we are qualified across these United States of America or we are not. And Georgia is saying that we are not. It is all or nothing. And what nursing is doing right now is that we are moving as one. We are moving as one. On my social media platform, I have seen social workers, therapists, nurse practitioners. We're all banding together because we see that this is getting ready to be a catastrophe as it relates to mental health care. This is going to be it's a public health issue, quite honestly.
It truly
It
is.
is a public health issue, and it is going to be a catastrophe if they do away with us not having the ability to provide care in the state, the way that we have been doing for as many years as we can even count.
Yeah. And if I can add a comment here, one of the things that we are hoping to, because we don't want to revisit this again. This is about a ruling that came out in the last few weeks, and we understand the impact it's having right now, but we fully recognize as long as we remain in the structure in the state of Georgia, who's to say when the next ruling will come out and what that impact will be, and potentially revisiting this crisis again. So I am not bashful in saying this part. We are moving for full practice authority. At the beginning of this segment, you asked us what delineated Georgia from other states, that independent autonomy that we're able to practice to the full scope of our training. That's what we're advocating for. We want our legislators, our senators, and our decision makers to realize that we're at a time in the state of Georgia. And here's the thing, it's no secret. The outcomes in healthcare in Georgia are not good. We don't have good maternal health care outcomes. We don't have good rural care outcomes. The data supports the need for changing the way in which healthcare is offered to our state. We're simply saying this. If the resources are here in the form of an APRN, why are we contesting an opportunity to work collaboratively, true collaboration, and that allowing APRNs to work to the full scope of their practice? Why are we hindering that? It seems contrary to progress. So in that regard, I am not bashful in saying full practice authority is where we have to go. We need to remove restrictions to allow our providers to work in a capacity they can serve their population and their communities and work in the communities that they live. A lot of these nurse practitioners and APRNs, there are remote options, and there's no question that across the board is to have benefit, but a lot of us work where we live. We work where we live. We know the neighbors and our church members and people that go to the mosque and the synagogues and wherever. We work and live together. And we are then the advocate for their healthcare options and expanding the reach for them to have access to healthcare. And without those options, we're essentially just robbing them of that opportunity towards preventative health, prevention of disease. I mean, these are the things we know as providers. So I did want to add that segue in there that we have some work to do in Georgia, but we are fully capable and ready to take on these efforts.
Absolutely.
And what misconceptions about APRNs would you like to correct?
The biggest, I think, misconception is that we are less than, that we're watered down versions of psychiatrists or medical doctors, physicians, or that we need constant oversight to practice safely. And that's just not accurate. We are extensively trained. We're board certified clinicians. We diagnose, we manage complex medication regimens, we provide therapy, ongoing care, and we do it well. The research backs that up. Patients under nurse practitioner care have outcomes comparable to physician-led care. We're not trying to replace anyone. I think if we ever wanted to be anything else, we would have done that a long time ago. We love being nurses. We love being nurse practitioners. Our scope of practice, our model of care is so vastly different than what a physician is charged to do, or what they're educated and trained to do. What we're trying to do is provide whole person, holistic care. That is how we've been trained, and that's all we want to do. We're trying to expand the number of qualified hands available to help, and the state desperately needs them. So that is the biggest misconception, is that we are watered down physicians. We are so much more than that. We are not that to begin with.
Yes, so the misconception, and right along with what Dr. Patterson is saying, there is truly a misconception that there is a desire to be something else. In other words, a wannabe, if you will, physician. Every nurse will tell you that we would not want to be a physician. We went to school to become a nurse, and those of us who chose to do advanced training as APRNs, this is exactly what we want to do. But our models are so different, and I wish there was a way that we can bring that across. It is the comparison of two models that can ultimately benefit a patient in a way that can advance and improve their health. It is walking into a space, and here's the thing, I believe in that patient choice. Giving the patient the option, and I keep saying this, if the gaps were not there, the nurse practitioners and APRN practices would not be viable or needed. The fact is that the increase in APRN care models and practices and so on is because there is a gap. And any nurse practitioner APRN that has a primary care, psychiatric service, behavioral health, high hydration, all of it is because there was a need. And as nurses, we are trained when there's a need, to Dr. Patterson's point, we advocate. And in the form of advocacy, we are opening up clinics, we are opening up platforms, we're opening up telehealth because we saw the need, and it frustrated. And I'll talk for myself. For me, my background is in house calls, home health care. So for me, I saw the need for my patient population, and it was frustrating to me. So from that frustration, I started doing house call practice as a business owner. And that's what nurses are doing. We are trained to solve the problem on behalf of our patients. So to answer your original question about the misconception is that we're trying to be someone else. We're not. We're literally doing what we're trained to do, answering the call for our patients and advocating on their behalf. And in this platform, it comes in the form of entrepreneurship often, but that autonomy that we're built to do is what we're going to keep fighting for in full practice authority.
Yeah.
For fellow nurses, how can they become stronger advocates without feeling intimidated?
Yeah. Don't be intimidated. Don't be intimidated. Don't back down. I've never believed in this, but we're not asking for permission. We're not begging for the crumbs. The only thing that's limiting us right now is the way in which the law is written. And that's where the advocacy and legislative comes in. I understand the apprehension of our community. I really do, because no one wants to be sanctioned, break the law, etc. Because we're compliant. We will follow the rule as written. It's what we've been doing. But if the way that the rules are written now are hindering us, and restricting us further and putting us further away from being able to provide care. We've complied, nurse practitioners in Georgia. This was the rule we're giving, have a composite collaborative agreement. We did that, and now the rug is being pulled out.
Yeah.
Following the rules, and the rug is being pulled up because we need to change it up. We need to change it up. So don't be intimidated. Advocate as much as there are organizations that are advocating on behalf of APRNs. Each APRN is a constituent to a legislator, and you're empowered to talk to your legislators. That you have the right to do as a constituent.
Now, let's dive deeper to your advocacy, leadership, and the future. What changes need to happen legislatively? And if you had one message for Georgia lawmakers, stakeholders right now, what would it be?
Remove restrictions in the state of Georgia. That would be my one message. Remove the restrictions in the state of Georgia. If you care about healthcare, if you care about Georgia as a whole, rural, urban, city, all of Georgia, and don't take our word for it. Here's the thing: don't take my word for it. Pull up actual data. Let's talk. Let's not base this on emotions and all. Pull the data. This is the message to our legislators. You pull the data for your state. Look at the healthcare outcomes of your state. And as it stands right now, if nurse practitioners are not part of the solution, you tell us why. That's the message to our legislators. Tell us why. Tell us, and not only us, tell your constituents why you believe that you would vote against full practice authority or removing restrictions as it is right now, based on the qualification of a nurse practitioner. You tell us why, based on the data, why that's not an answer to this, the challenge we're having in the state.
Yeah. Mine is the same. It is restricting, qualified mental health providers does not protect Georgians. It abandons them. Not only that, but you have a workforce of skilled, dedicated nurse practitioners who are ready and able to serve the state. Not only that, in addition to that, it is very poor oversight, very embarrassing, so to speak, if you have nurse practitioners such as myself who are, able to provide mental health care in other states, improving their outcomes, and I can't take care of my neighbor who's sitting right next to me. That is embarrassing, that I am not able to improve the outcomes in the state that I live in, but I'm improving the outcomes in other states because of full practice authority and independent practice. So the cost of inaction isn't abstract. It's measured in people who couldn't get an appointment when they needed one the most. So that would be my message to the lawmakers.
What gives you hope right now despite the challenges?
Well,
That's a good question. I love the question.
Well, first, what we're seeing, I think that, Dr. Hurlock can also attest to this, that we are seeing that, again, our nurse practitioners are finding their voice and refusing to stay quiet. And that collective energy is powerful. Even the Georgia Board of Nursing recently has stepped up to gather information on how this is affecting APRNs and the communities we serve, which tells me that people they're paying attention, right? And then second, the patients. Every single day I get to watch, someone go from barely functioning, hanging on, to rebuilding their life. And that reminds me of exactly why this fight is worth it. And then finally, I think the other thing is the simple fact that the truth is on our side. The truth is on our side. Like Dr. Hurlock said, the evidence is clear. When more states see that, the momentum keeps moving forward in terms of how we provide access. And I believe that, Georgia will get there, but we just have to continue the fight. We have to continue to chip away at this archaic belief that we are not fit to do the job that we have been trained to do. We've spent many years being educated. Most of us have, spent many years on the floor, on the front lines, honing our craft and our skills. So for someone who doesn't even walk the shoes that we've walked to tell us that we're not equipped to do this it's false. It's a false narrative. That's
It is indeed.
simple. It's false.
Indeed. Absolutely. Yeah. And likewise for Dr. Patterson, my hope comes in patient outcomes.
Yeah.
Patient outcomes. My world is slightly different. I work with gerontology, homebound patients, elder adults. But when I can walk into a patient's home that would otherwise have gone without primary care options, it is humbling. But it gives me hope that the opportunity for access to healthcare, it is tied into the work that I do every day. And I said at the beginning of this recording and with this conversation that we need to tell those stories as APRNs. And the data for sure will support it, but I think our legislators need to recognize that there is a true and tangible benefit to APRNs, and to act in any way that is contrary to allowing us to perform our duty as we see it is contrary to providing good patient care and wanting good patient care for the state of Georgia.
What does accessible mental health care look like to you, and why is it worth fighting for?
Sure. Well, accessible mental health care looks like when a person decides they're ready to ask for help, that help is actually there. How about that? Not in 2 months, not in 3 counties away. It's there when they need it. That is accessible. It means that we use every qualified nurse practitioner. And, I'm not going to completely speak for physicians or physicians associates or assistants, but it means that we use every qualified provider. We have, instead of sidelining them, we're putting well-equipped clinicians on the side, and also jumping ship and just, providing care in a different state, because mental health professionals can do that. That is the beauty of telehealth. So, we're either going to have people that are fighting for this access to care, meaning patients and clinicians in general, or they're going to abandon ship. And we have to be, that's the reality of it all, because we have bills to pay. We have bills to pay, we have families to feed, and, pulling the rug out from underneath us means that we're going to have to pivot. But some of us are going to fight, and it's worth fighting for, because mental health is health, full stop. So behind every statistic about access is a real person, a parent, a teenager, a veteran, someone's best friend who deserves a chance to feel better. And so I fight for this because I've seen what happens when care is there. And I've also seen what happens when it's not. I can't in good conscience accept a system that leaves people behind when we have the ability to help them. So that is accessible mental health care to me. It's there when people are ready to utilize it.
So in that regard, the pivoting of access outside of the state of Georgia, that's a very important fact I think we're missing here. The assumption that Georgia has the right to all the qualified persons that are housed here, meaning to reside here. The fact is that there is a platform that allows individuals to reside in the state of Georgia and seek employment outside of the state, i.e. telehealth. And in addition, individuals are choosing to either commute or just outright leave the state. So we already have a state that has the burden of poor healthcare outcomes, well documented, adding restrictions on top of the qualified persons who can answer the challenge of those poor healthcare outcomes, compounding it with further rulings that are restricting those very individuals. Do you see how this is so contrary to progress? So the workforce challenge that this is now going to compound, it defies logic. Yeah. So I need Georgia, I need the legislators to understand that there is a real impact this in terms of just not having the qualified individuals. The time that we're taking to quote figure this out, people are making decisions. Dr. Patterson made a great point. Livelihoods, income, businesses, the clock is ticking. So if we really want to take the chance that we're going to lose those qualified individuals to other states, I don't think it's a risk that we want to take as a state that already has some poor healthcare outcomes and needs the qualified APRNs that are here.
Yeah. Yep. Georgia is in mental health crisis. It is in a mental health crisis. People wait months for care, and entire communities have no psychiatric provider at all. Nurse practitioners are on standby, willing to close the gap. We're trained, we're board certified, but here at home, the new barriers pushing us to seek employment and improve outcomes elsewhere is closing in. The gap, there is just, it is what it is. And the one thing I want everyone listening to this, if you're in the state of Georgia, you need to be contacting your legislators. You have to speak up. This is not a one-sided organizational, plight. This is everyone's plight here in Georgia, because if patients are listening to this, they're going to be without a clinician, plain and simple. Your appointment times are going to be even longer. Your appointment wait times are going to be longer. And then there are all these rules where we can't even, see patients across states, which is a whole nother thing. So you will be without healthcare. You will be without healthcare, and you have to act. You have to contact your state legislators to tell them that what you're doing is wrong and that it is patient abandonment. That's what I want you all to say.
Yes, likewise. The message is that on the side of the APRN, the message is simply this: fight for your profession, fight for your patient. And I do want to acknowledge this, that throughout the state of Georgia, in terms of APRNs, all may not be impacted equally depending on their particular place of employment, their specialties, and so on. So let's recognize that, but also recognizing as a unit, as APRNs unified in a profession, we're all fighting together. Regardless of my specialty is gerontology, Dr. Patterson is mental health, the person next door may be a particular specialty that goes into like diabetes management, hypertension, it doesn't matter. And I need us to know that we are presenting ourselves as a unified front, fighting on behalf of our patients and access to healthcare. That's on the APRN side. To patients who may be listening to this in the state of Georgia, you're empowered as well. If you've benefited from a nurse practitioner, if you've benefited from an APRN, let your legislators know, but for the access to care from my APRN or my nurse practitioner, I would not have had access to healthcare. And that can come from patients. And on our legislative side, invite us to the table. I would welcome an actual dialogue that speaks of facts and not emotions. That's what our challenge has been in this legislative fight. A lot of this is based on emotions and misconceptions. But I would welcome a conversation with legislators who are really serious about advancing this situation and this particular crisis for sure. But the long game, let's resolve this. Let's move past this, and let's do it on behalf of patients and the constituents of Georgia.
Mm-hmm. Yeah, and also one more thing, you need, for the patients, just tell them that your access to mental health care and health care is not a political bargaining chip. It's a lifeline. That is what I want you to walk away with here today. You need to tell them across the board that your access to health care in this state is not a political bargaining chip. That's it.
Don't be intimidated. You're joining an amazing profession. I've been a nurse for over 20 something years. I'm sure Dr. Patterson has the longevity just as I do. I would not do anything different. Nothing different. I love what I do. And those who are in school, finish your degree and come join. Join the efforts. For sure. Don't be intimidated. There's nothing to be intimidated or discouraged about.
Nothing. I think nursing is the most resilient profession ever, quite honestly. We have been, fought against in so many different ways, and every time we come back bigger and stronger. We are the most trusted healthcare profession for over 25 years. And so you're joining, a profession where we really take care of each other. When we see things that are not correct, when we see things that are not right, we will stand up and fight for that. And that means our students as well. We understand that there's even struggles that you're going through right now with just getting your education funded. And believe you me, there are fights happening way above, what we're doing here in the state of Georgia. And I just encourage you to continue to, pursue your education so that you can also be a part of the number that we, the numbers that we continue to, nurture and grow.
Tonight's conversation reminded us that behind every healthcare policy is a human being trying to get help. Patients are waiting while providers are being blocked, and mental health care delayed is mental health care denied. If psychiatric mental nurse practitioners are trusted to care for patients across so many states, many are asking, if we are qualified in 28 states, why not in Georgia? Why not here? Because at the end of the day, this is not about titles. This is about access. To Dr. Joanne Patterson and Dr. Nancy Hurlock, thank you for your advocacy, your leadership, and for continuing to fight for both providers and patients across Georgia.
Thank you so much for
Just thank you for the platform.
For giving us the platform to, express the high need here in this state.
And to everyone listening in, let us stay informed, let us stay engaged, and continue speaking up for accessible mental health care. These have been Mindful Moments with Pedro Morante. Always remember, take care of each other, make your mental health as a priority. We are in this together. I trust that you will prioritize your mental health because there is no true health without a good mental health. I am humbled and honored to be part of this podcast, Mindful Moments with Pedro Morante. For more mindful conversations like this and meaningful engagement, please do not forget to like, subscribe, and share or tag someone who needed to hear this conversation. Please do not forget our live review on June 10 with your Professor Letty and yours truly, Dr. Pedro Morante, Psych Mental Health Nurse Practitioner with Doctor in Nursing Practice. I appreciate all of you and keep on thriving for your mental health. Bye-bye. Take care.
Thanks for listening to Mindful Moments with Pedro Morante. Be sure to follow the podcast so you'll never miss an episode. If you find value in our time together, leave a quick review. It helps more people discover the space we're creating. For updates and more reflections, follow us on social media. Until next time, take care.